Morning, everyone, and welcome to the third and final GIC annual public information session. My name is Matt Vino, Executive Director at the Group Insurance Commission. Thank you for joining us. We look forward to sharing some important information with you about this year's annual enrollment, the outcome of the procurement of our health insurance and pharmacy vendors, as well as some other useful information and resources for you all. We do have closed captioning for this presentation, as well as an American Sign Language interpreter. If you would like to see the ASL interpreter larger on your screen, you may pin that participant by clicking the three dots on their video feed. A link will be posted in the chat function for your access. We also are recording these information sessions, which will be available on the GIC's YouTube channel. I want to welcome you all, and to start, I'd like to review the agenda. We will be on the next slide. We'll provide a brief overview of the Group Insurance Commission. Many of you are already familiar with us, so we won't spend too much time on that. Then we'll walk through the changes coming to the GIC's health insurance and pharmacy benefits as a result of the procurement that our commission voted to approve last fall. We will next discuss proposed changes to our health insurance plan design for the coming year for members enrolled in both of our active and Medicare plans. And finally, I'll share some information about an additional set of sessions we are hosting in the spring ahead of annual enrollment. After that presentation, which should run about 30-35 minutes, we will be responding to questions that you have. So with regard to questions, on the next slide, you may submit those at any time during the presentation through the Zoom Q&A function. Next slide, please. We have members of GIC staff on hand to answer questions directly in writing, also through the Zoom Q&A function. Some of the questions that, if we think they are of general interest, we will answer verbally for the benefit of all attendees once we get to that Q&A session. If you have a question that is personal and specific in nature about private details about your healthcare, please utilize the contact form listed here on the slide below. GIC staff will not be responding to those types of questions so that we maintain your privacy. So before we jump into the GIC overview, I want to note at the outset the dates of this year's annual enrollment. As you see here, it will run from April 5th through May the 3rd. And as you see on the next slide, I encourage everyone to go paperless by registering for the GIC member benefits portal called MyGICLink. You can register by visiting the GIC's website at mass.gov/GIC. All state and municipal active employees and retirees that have a valid email address have access to this portal and will be able to update your personal information and view your benefits 24/7 all throughout the year. You'll be able to also learn about and register for future member information sessions ahead of the annual enrollment. And during annual enrollment, you'll be able to compare your benefit options and enroll in coverage. I do want to note that the MyGICLink portal is completely voluntary. You may, if you like, continue to submit paper forms to the GIC for annual enrollment or for any other changes that you have. And of course, always feel free to contact our staff directly. But this is a new tool, a very sophisticated tool that's quick, easy to use, and is a convenient alternative for those who are comfortable with it. So I encourage everyone to check that out. So now we'll move on to a brief GIC overview. And of course, we start with the GIC's mission on the next slide, which is to provide you with high quality and affordable benefits while driving improved health for members and just higher value delivery of care across the Commonwealth. So this continues to be really our guiding star. As you know, the GIC strives to deliver on this mission by offering a wide array of coverage options, including healthcare, dental, vision, life, as well as long-term disability benefits and flexible spending accounts and our Mass for You employee assistance program. So here we highlight some key points, data points about the GIC. We have over 460,000 members, which makes us the largest purchaser of healthcare in the Commonwealth of Massachusetts. We are governed by a 17-member appointed commission. And as you'll see in the lower right, we partner with a wide array of agencies, 918 in total, that include cities and towns, regional school districts, and a variety of different state and local agencies. So this chart is really a visual explanation of how the GIC is funded. As you can see, the Commonwealth of Massachusetts, through annual appropriations, funds the lion's share of your benefits. That's the large blue, dark blue slice. Cities and towns that also purchase insurance through the GIC for their employees also fund a portion of the premium, noted here in green. And of course, you, our members, also fund a portion of the premium seen here in purple. So I want to note that the GIC's health benefits are financed in a slightly different way than you may have seen elsewhere. That's because the Commonwealth is self-insured through the GIC. So what this means is that the Commonwealth, of course, the Commonwealth, as I've noted, pays the employer share of medical claims, but also the total of any excess of claims that may occur beyond what is anticipated when we set our premiums. The state, therefore, holds the insurance risk. If you can go back a slide. Yep, there, thank you. So the Commonwealth holds the insurance risk, not our insurance companies. So if medical claims exceed the amount that we've budgeted, the state will pay those claims, and it doesn't impact either our members or our municipal partners. So in practice, at the bottom here, the way this works for us is that when you, as a member, receive your healthcare service, your doctor sends a bill to the insurance company that in turn pays that doctor. That insurance company then bills the GIC, and we reimburse the insurance company for that service. So before we move on to health insurance premium rates, on the next slide, just a quick reminder that you may submit questions at any time during the presentation in the Zoom Q&A function. Again, please don't type in questions that are private, personal, or specific in nature. Again, next slide, please. And use the contact form if you have those types of questions, and our GIC staff will follow up with you. So now I'll move on to say a few words about our premium rate development for the coming year. This portion of the premium, again, will be brief because we are still working on this. We still have a few decisions to make, and we will be completed that work in early March. So on the next slide, you'll see our timeline for finalizing our premiums this year. As you can see, we start with an initial discussion with our commission about preliminary rates back in our December 15th meeting. This is based on the information that we had at that time, and really it involves looking ahead to the coming fiscal year. So that's 6 to 18 months into the future. Of course, that involves some uncertainty. And then last week, we presented to our commission the preliminary plan design changes, which we'll review with you momentarily. And at both of these meetings, we do post these on our GIC's YouTube page if you're interested in watching those meetings. At our next commission meeting on February 16th, our commission will be voting on the proposed plan design changes. And following that, in our March 2nd meeting, we'll vote on plan-specific premium rates for the coming fiscal year. So overall, from December to March, we use this time to refine our plans, to make all the necessary changes, learn more about our cost projections so that we can make sure that the premiums are as accurate as possible. On the next slide here, you'll see the expected aggregate increase is an average of across all of our plans. So both Medicare and non-Medicare all into one number. So it's important to note that specific plans, as I mentioned, will have their own specific increases, which may fall outside of the overall range that is noted here in the green boxes. Those are the specific numbers, as I mentioned, that we'll determine in early March. So I want to draw your attention to the gray box below the arrows. At this point, we are projecting an aggregate premium increase across all of our plans of 6.7%. That is within a possibility range of between 4 and 8%, which is noted in the green boxes on either side. While this 6.7% increase, it is higher than we'd like to see, but it is lower than the types of increases that most people are seeing in their insurance outside of the GIC. And you'll see that noted in the yellow boxes above the arrows. So please know that this is a number that we do all in our power to try to keep down and to moderate these increases on your behalf over time. So next, we'll review the results of our health benefits procurement. As those of you who have followed our work over the last several months, you'll see that this is somewhat familiar to you. So by way of background, we are currently in the 5th and final year of contracts with our current health plans and pharmacy benefit managers. We are required by state law to go through this procurement process at least every 5 years to choose the companies with which we work. As you'll see here in 2021, we spent most of the year developing our strategy, gathering information, reviewing our data, talking with outside experts, and engaging with you, our members. And this included a member preferences survey that many of you participated in last summer. For those who completed the survey, thank you very much. The feedback is extremely helpful to us. In the spring of 2022, this past year, we issued our request for responses to these companies. And then after reviewing what they sent us back, we developed our final strategy and presented our recommendation to the commission, which they approved unanimously in October and December. So we are now finalizing all of our changes so that we can be ready to offer coverage in the coming annual enrollment. And this will be for coverage starting on July 1st of this year. But before we do all of that, these sessions are our way of informing you of what we're contemplating and getting your input. As we do every year, we share all the input we receive at these sessions with our commission at our February meeting. So our 3 main areas of strategic focus in all of this work continue to be threefold: to provide quality benefits that are as affordable as possible, to close gaps in health equity that are structural and longstanding challenges facing us and others across Massachusetts and the country, and to do our best to improve access to behavioral health services. As a result of the procurement, we will have new companies to manage the pharmacy benefit manager for active members and for our flexible spending account. And I'll say a little bit more about those here. So prescription drug benefits for active and non-Medicare retirees will be transitioning from Express Scripts, who has done it for the last 5 years, to CVS Caremark. However, for those of you enrolled in Medicare plans, prescriptions will continue to be administered by CVS through the Silver Scripts program as they are today. So no changes for those enrolled in Medicare. It's important to note here, in case there is confusion, that a pharmacy benefit manager, which is the company that we work with to administer this benefit, known as a PBM, is different from a retail pharmacy. So while the CVS brand name applies to both of these businesses, members who do not have access to a CVS retail pharmacy, or who have a pharmacy that's not a CVS that they prefer to use, you will still be able to use those non-CVS pharmacies. So I want to make sure that is clear. We've been getting a number of questions on that through these sessions. Also, as you'll see below here, starting on July 1st for our active employee members, our flexible spending accounts, which are often known as FSA or Health FSA, will transition from Benefit Strategies, currently Voya, to a company that is called Task. They're a very experienced company working on these types of benefits. We'll be working very closely with them to make sure that this changeover is seamless for you, our members. That will include a grace period during the transition. So if you are enrolled in this plan, you will see some changes coming, but the program itself should not change for you. Now I want to move on to plan design changes that we are recommending to our active medical plans. On the next slide, which should look familiar to you, these are our current plan offerings for active and non-Medicare retiree members. Also below, you'll see some of the specific cost-sharing features of these plans. As a result of merger of some companies, which I'll talk a little bit more about, and changes that companies are making to their own brand names, we will have some changes, but the important thing to note here is that all of the carriers that we work with today, we will continue to work with heading into the next fiscal year. They all submitted bids, and we selected each of them to continue. So I think that is good news about continuity. That said, there will be some changes that will be happening in the coming year that I want to make you aware of. So on the next slide, you'll see a summary of changes which to plan design, which, if approved by the Commission, will become effective on July 1st. Next slide, please. For residents who live outside of the 5 New England states, we will be offering you a new plan. This is a PPO, Preferred Provider Organization plan, through Harvard Pilgrim Healthcare. This will replace Unicare Basic as the option for members who reside outside of the New England states. There will also be a significant change to the premium structure for those current Unicare plans that today include the CIC, catastrophic insurance coverage, which I think members will like. Again, we'll go into a little more detail on that in subsequent slides. Additionally, there will be some minor changes to Unicare copays to standardize them with those plans that are offered, the other plans that are offered in New England. Next, there will Always Health Partners has recently changed their name to Mass General Brigham Health Plan, and we will be making some changes that will make it available to all residents of Massachusetts, not just Eastern Massachusetts. Again, I'll talk a little bit more about that. And then finally, as I suspect many of you know, Tufts Health Plan and Harvard Pilgrim Healthcare have merged under the same parent company. This is called Point 32 Health. And as a result of that merger, this company has chosen to offer only Harvard Pilgrim for our active plans. So the Tufts Navigator plan and the Tufts Spirit Narrow Network plan will no longer be offered starting on July 1st. I want to emphasize here that the discontinuation of these two plans is based on a decision made by Point 32 as a private company, not a decision made by the GIC. But we will be offering very similar plans to those of you who are currently enrolled in these two plans. Again, we'll touch on that shortly. So because of the changes to many of the health plans, we'll be renaming most of the plans to help mitigate confusion. So it's important to pay very close attention to our offerings this year. So first, I want to note in the upper right here that Health New England, which is our regional network for those residing in Western Mass, will not be changing in any way. As I mentioned previously, here again in the upper left, the national plan for those residing outside of New England will be Harvard Pilgrim Healthcare, and that plan will be called Access America. The broad network plans in the middle box here for those residing in New England will be a Unicare Total Choice. For those of you who are familiar with the Unicare plans, this is formerly the Unicare Basic Plan. This will continue as the GIC's Indemnity Plan, which will also be available to international residents as an indemnity plan. We will continue to offer Unicare Plus. The name there will not change. That is the other Unicare indemnity-based plan. The Harvard Pilgrim Point of Service Plan, which is available across New England states, will be called the Explorer POS plan. This does require a member to designate a primary care physician, as all of our POS and HMO plans do. Always Health Partners will now be called Mass General Brigham Health Plan Complete HMO. And as I mentioned, that will now be available to all Massachusetts residents in all parts of the state. And then finally, under our limited network plans, both of these are available statewide except for Nantucket and Martha's Vineyard. Those will be the Harvard Pilgrim Healthcare Quality HMO. This again is a new name, but it's very similar to the Harvard Pilgrim Primary Choice product that you're familiar with. And then finally, Unicare Community Choice will continue with the same name as it has today. So I know there's a lot of name changes here. So later in the presentation, there'll be a slide that goes into further detail about how these current plans compare to the newly named plans. So now I'll go into some further detail here on the Unicare plan changes. First, as you know, two of the Unicare plans, that's Unicare Basic, again now to be known as Total Choice, and Unicare Medicare Extension have a premium component known as CIC. So this is a component that if you choose it, this is a member pay all additional premium. The state does not today pay any portion of that. This is a program, the CIC, that really is a statutory legacy that dates back several decades, and in our view has been made really redundant by the way health plans have evolved over that time. Market changes, plan design changes, regulatory changes. So we wanted to make an adjustment here. So if you've selected one of these plans in the past without the CIC component, you will have been left with significant financial risk since coinsurance applies to certain services there. So what we are recommending is to wrap in the CIC premium component going forward for all members in these two plans. So this will be wrapped into your overall premium. What this means is that the Commonwealth will absorb its portion of that additional premium based on your date of hire. So if you are a state employee with less than 20 years of service, the state covers 75% of your premium. That percentage will now apply to the CIC portion. You will not have to pay that all out of your own dime. Same if you're more than 20 years of service and you have 80% that the state is paying on your premium, the state will now pick up 80% of the cost of the CIC. So this is a change that will really harmonize CIC coverage across both these Unicare plans, which will now include it as part of their premium. So it's a little complicated, but for those of you in these Unicare plans, I hope you know what we're trying to do here. Other changes to the Unicare plans are really aimed at standardizing copays across all the plans that we offer. The first will apply to outpatient copays to Unicare plans. The copay for the coming year will be $150 for eye services and gastrointestinal services that are received at ambulatory surgical centers. And there will be a $250 copay for all outpatient services. This essentially makes the copays for Unicare plans the same as they are for all of our other broad network and limited network plans that we offer. Additionally, Unicare Choice, Total Choice will have a $45 copay for all specialist office visits. For this option, we're actually removing tiering to make the plan more simple for its users. Lastly, Unicare Plus and Community Choice will have the same copays for PCP visits as all other GIC plans offered. So minor changes here, but ones to pay attention to, please. On the next slide, we'll dig into the changes to the Always plan, again known as Mass General Brigham Health Plan going forward. As you know, this is a plan that we've offered for a number of years. Before they were named Always, they were called Neighborhood Health Plan. And again, I want to note these are changes to the company that are made by the company, not by the GIC. But in addition to these name changes over the last few years, the plan itself has changed a lot. While they used to use a regional network for mostly the kind of central and eastern part of the state, they have expanded significantly to where they now have reach across all of Massachusetts. So this allows us to expand our coverage statewide as well. And it used to have a lower premium than other plans offered by the GIC. So we need to make a few changes here to accommodate how this plan has evolved. As I said, first of all, it's now available in all parts of the state. But in order to make sure that we have aligned member incentives across our GIC population, we are applying higher cost sharing for providers and facilities that are higher cost. And this aligns with the same approach that we use across all of our plans. So what this means is that if you're a member who wants to remain in this plan, you will see higher co-payments depending on where you get your inpatient care. If you go to a high-cost hospital, you'll pay a higher copay, and you can see the new copay structure explained here. So this slide summarizes all of the changes that I've discussed. Across the top, you'll see the health insurance companies that the commission approved back in the fall. At our October meeting, and the chart below shows the recommended changes to plan names and co-payments, the co-payment changes being highlighted in yellow. So on the next slide, which I want to linger on a little bit because there's a lot of information here, you can observe how we are, how our current offerings on the left compare to the new offerings and who among our population they impact. So while we will ensure that everyone who currently has coverage will continue to have coverage, we do strongly encourage members to spend time evaluating all of your options and shopping for a plan that meets your needs. If you do not select a new plan yourself, we will automatically place you into the most similar plan that we offer. And that is what we show here under the FY24 plan. And you'll see on the right what the changes are that are being made to that plan. So strongly recommend that when you get your benefit guides in advance of annual enrollment, check with your doctors and hospitals to make sure that they are included in the new network, whether you're being default automatically enrolled into a plan or you're choosing a new plan. This is a really good year to make sure that you're paying close attention to your health insurance options. So next, I'll go into the changes to our Medicare plans. The first I discussed earlier around the Unicare changes, which is the change to the Unicare Medicare extension. If you're in that plan, you will no longer have to pay separately for CIC coverage. That is being rolled into your overall premium and coverage. Second, as a result of the 0.32 merger of Harvard Pilgrim and Tufts that I mentioned earlier, the Tufts Medicare Complement Plan, which is our Tufts Medicare Supplement offering, will no longer be offered going forward. So again, we encourage those of you who are currently enrolled in this plan to evaluate all your options during annual enrollment. However, if you do not choose a plan actively, we will automatically transfer you into the Harvard Pilgrim Medicare Enhanced Plan, again, a Medicare supplement plan, which is nearly identical to the plan that is being discontinued. And again, I want to note that there are no changes to the Tufts Health Plan Medicare Preferred Plan. This is our Medicare Advantage option. And there are no changes to the Health New England Medicare Supplement Plan. So I know I've covered a lot of ground today. You likely still have questions. I'd like to remind you that you may submit the questions at any time during the presentation via the Zoom Q&A function. We have members of GIC staff on hand to answer those questions directly in writing, also through the Zoom Q&A function. Some of your questions that we may think will be of interest generally to others, we will address them live and verbally in the Q&A function. And again, if you have a specific personal question, please don't type it in the Q&A, just contact us on the member contact form listed here. So as we start to round up here our presentation, I'd like to invite everyone to another opportunity to engage virtually with the GIC ahead of annual enrollment. This year, we are pleased to offer new annual enrollment sessions in March prior to the annual enrollment. There will be 2 sessions dedicated to retirees, and that includes both those on Medicare and non-Medicare members enrolled in our active plans, and 3 sessions for active non-retiree members. These will be conducted very similar to this session with an overview of the options of annual enrollment and the opportunity to ask questions via the Q&A function. So these sessions will be a little different though, because we will have finalized all of our decisions, plan design decisions, premium rate decisions. And so we really do encourage folks to who are here today to even log back into these in March. So a final reminder that our annual enrollment will be April the 5th to March the 3rd. And as we transition into our Q&A function, I'll hand it over to Emily Williams, our Chief of Staff, in a moment, but we will bring up the slide that has additional resources available for reference for you. Emily, if you can bring that up, perfect. So with that, thank you for your patience while I walk through that, and we are happy now to turn to the Q&A function and Emily Williams to assist us.
Thank you, Matt. And the first question we've received, a lot of people asking if there will be any changes to the dental and vision benefits.
There are no changes to dental and vision benefits this year, nor are there changes to life and LTD benefits. Those are procurements that we made decisions on in prior years. So the answer to that is no.
Thank you, Matt. And we've received a few questions asking if my spouse is turning 65 and registering for Medicare, but I'm not turning 65 yet, do I need to do anything to continue my coverage with GIC?
So this question I'll turn over to Paul Murphy, who's our longtime director of operations at the GIC and the expert on these matters. Paul?
Thanks, Matt. What I would like to do is probably give a brief summary of how it works when we have members that are turning 65 and spouses that may be older or younger than 65. First thing is, if you are retired from the Commonwealth and you have GIC coverage, GIC will reach out to you and or your spouse 3 months prior to your 65th birthday. We will give you a letter with instructions and the ability to elect a Medicare plan with the GIC. State law does require you to enroll in a Medicare supplemental plan if you are eligible for Medicare Part A and Part B. So 3 months before the 65th birthday, you or your spouse will be notified with instructions on enrolling in a Medicare plan. If a spouse is younger than the member, then what will happen is if there's no other dependents on the plan, we will enroll the member who is 65 or older in an individual Medicare plan, and the spouse can remain in the non-Medicare plan. So we basically eliminate the family plan and we treat it as 2 individual plans. If you are retiring from the Commonwealth and you are over age 65, when GIC receives your retirement information, we will send you a letter with same letter instructions on electing a Medicare plan with the GIC once that we have been notified with retirement information from your agency. If you are turning age 65 and you continue to work for the Commonwealth, there is no need to enroll in Medicare Part A or Part B. The health coverage you have with the GIC when you turn 65 and you continue working remains primary, and there is no need to enroll in Medicare Part A or Part B. Once you retire, you will be required to enroll in Medicare Part A and Part B. One question we get a lot of is, if I'm not eligible for Medicare Part A for free or Medicare Part B, what happens to my coverage? If you apply to Social Security for Medicare Part A and Part B, and they indicate that you are not eligible for Medicare Part A and Part B, that is the information GIC will need, and we keep you in your current non-Medicare plan after age 65, but only in the case if you are not eligible for Medicare Part A and Part B. The Medicare Part A and Part B eligibility is determined by the Social Security Administration, not by the GIC. So you will be required to apply for your Medicare benefits A and B directly with Social Security. If you're eligible, we require you to join a Medicare plan. If you are not eligible, you can remain in the non-Medicare plan that you have.
Thank you. And I think a follow-up question for you, Paul, is what plan options are available for retirees who will be traveling outside of New England?
For retirees that are traveling outside of New England, the Medicare plans that GIC offers, with the exception of the Tufts Medicare Preferred, cover you nationwide. So all of the plans we offer will cover you nationwide, with the exception of the Tufts Medicare Preferred, that is a network of hospitals and doctors primarily in Massachusetts.
Thank you, Paul. And sticking with you, a follow-up to the follow-up is, and what are the options for retirees who travel overseas?
For retirees who travel overseas, again, there's a couple of things we need to mention here. If you are traveling temporarily outside of the New England area, all plans cover you in emergency situations. If you're going to temporarily reside outside of Massachusetts, GIC would ask that you keep your primary residential address Massachusetts so that you're able to get the most plan eligibility and keep the benefits that are available to you. So if you're temporarily going outside of the area to Florida, Arizona, California, 2 to 3 months out of the year, we always want people to keep their primary residential address on file with GIC. That will give you the maximum benefits allowed by your plan. If you are permanently going to move outside of the service area, outside of Massachusetts, then the new plan, Harvard Pilgrim Access America, is the plan that you will be eligible for.
I do just want to note too, thank you, Paul, that we do have, as you can tell, and as we know from all of these sessions, turning 65 involves a lot of complex steps, some of which are steps you need to take with us. Some of them are steps you need to take with Social Security. And we do have some really excellent information on our website to guide you. We have a member video called Turning 65, which walks through some of these key elements. So encourage people to check out our website and the resources they'll find there.
Thank you, Matt. And we received the same question for active members. If they are traveling overseas, will they be covered by their insurance plans?
Yes, traveling outside of the service area is covered in emergency situations from all of our health plans. If you were going to permanently reside out of the country, then the Unicare Basic Plan is the plan that will cover you. Soon to be called Unicare Total Choice, but that's only if you are permanently moving out of the United States.
Thank you, Paul. And we have the question, with many plans changing, who should I contact to find out if a pre-existing condition will still be covered by a new plan?
The pre-existing condition doesn't apply to any of GIC plans. So if you have a pre-existing condition and you change plans, you don't need to worry. Pre-existing conditions are not excluded under any of our health plans.
Thank you, Paul. And we have a question about the FSA vendor change to task, asking if the new vendor will also apply to transportation benefits offered by the Commonwealth.
So transportation benefits is not a benefit that is managed by the Group Insurance Commission. There's often been some confusion about this in the past because we have used the same vendor, Benefit Strategies. So you'd have to check with the comptroller's office about that benefit. Our understanding is that they are continuing to proceed with Benefit Strategies to manage that. Cameron, maybe there's something you want to add to that?
Nope, that's correct. The GIC has no involvement with the transportation or parking benefits that, to the best of our knowledge, will remain with Benefit Strategies, now Voya.
Thanks, Cameron.
Thank you, Cameron and Matt. And we have a question. What do I do when if I have a dependent who is turning 26? Do I need to contact the GIC? What steps should I take?
That's another good question for Paul Murphy.
For dependents turning age 26, GIC covers the dependent until the end of the month in which they turn 26. If there are no other dependents on your plan, GIC will change you to an individual coverage. But if there are other dependents, the family plan will stay in place. But we will automatically remove the dependent at the end of the month in which the dependent turns 26. And we will also send out information regarding continuation of benefits through COBRA.
Thank you, Paul. And on the same question of dependents, if I have a child who is going to college outside of New England, should I choose a specific plan or will they be covered?
The outer area network benefits for dependents varies among the health plans. I would recommend that for coverage questions for your dependent, you contact your health plan directly. That is determined at the health plan level, not GIC. The eligibility to cover the dependent has not changed, but benefits regarding service area and outer network benefits for dependents should be directed to your health plan.
And on that note, I just want to remind our members that, again, on our website, we have an entire page dedicated to information about our different carriers, how you can reach them. So if you're looking to ask them questions of this type, feel free to visit our website. If it's your current carrier, you can also just use the number that's on the back of your card to ask them these types of questions.
Thank you, Matt and Paul. And we've received the question, will the GIC be considering or offering an individual +1 plan outside of the family or just individual plans?
We are not making that change at this time. We do occasionally get this question, and we do continue to evaluate what the impact would be of making that change. One of the things that we consider is the impact across our membership should we make a change like that, and particularly the impact, whether it be significant increase or decrease on members depending on their status. So we continue to evaluate this, but we're not proceeding in that direction at this time.
Thank you, Matt. And we have a question about mental health providers. Are there separate mental health providers for the GIC, or how should I evaluate my options?
So each insurance carrier has their own network of providers. That is, of course, true for medical and healthcare services, including mental health services. So again, this would be an area where you will want to understand which providers are in a different carrier as you shop and evaluate all of your options. Each carrier will have a provider directory, so you can check to see on that directory whether the providers you have there today, whether it's mental health or other services, are covered by that health plans network. It's another good reminder to really shop and evaluate the different plans and how their networks differ.
Thank you, Matt. And we have the question, if you are eligible for dental vision benefits, can you enroll in those without enrolling in health insurance benefits?
I think that's probably another question for Paul Murphy.
Yes, the GIC's dental vision plan, currently through MetLife and Davis Vision, you can enroll in GIC's dental vision plan without enrolling in health insurance. It's not required that you have health insurance.
Thank you, Paul. And similar question is, can you only sign up for life insurance during annual enrollment?
The life insurance benefit that GIC offers, there's two of them. The first one is the basic life insurance. So you can sign up for basic life insurance only during annual enrollment for coverage effective July 1st. If you are electing a health plan during annual enrollment or you're currently enrolled in a health plan, you are automatically covered with the GIC for the basic life insurance policy. It is included in your health insurance premium that's deducted from your payroll or pension check. For active employees, GIC also offers the ability for you to enroll into 8 times your annual salary for life insurance. Now, this is only available to state employees, not available to any municipal employee. If you did not sign up for that benefit when you were first hired or come in during annual enrollment, you can apply for that benefit anytime during the year. The insurance company will require medical evidence, proof of good health for you to enroll, but signing up for the supplemental life insurance as an active state employee can be done anytime during the year, not just during annual enrollment.
Thank you, Paul. And we have a question about the pharmacy benefit manager change. Under the new pharmacy benefit manager, will mail prescriptions still be available?
They will be. We strongly believe that mail order is both a more convenient and cost-effective option, particularly for prescriptions that are maintenance medications for chronic conditions and the like. So that will continue to be an option through our pharmacy benefit with CVS Caremark, the PBM.
Thank you. And if I receive my prescriptions from a non-CVS pharmacy, will I still be able to go through them?
The answer is yes. As I mentioned during the presentation, we are changing our pharmacy benefit manager for those enrolled in our active employee plans, but you will continue to have wide choice when it comes to the retail pharmacy that you go to fill your prescription. You won't be limited to the CVS retail pharmacies.
Thank you. And we have a question asking if the GIC will consider eliminating the current 2-month waiting period before insurance coverage begins.
Yeah, it's a great question, one that we get frequently. And for those who are not aware, for new hires, we do have a 60-day waiting period for coverage to become effective. This is something that we are very interested in addressing and are working hard to address, to either shorten that wait period or ultimately eliminate that wait period. This is a complex project that the GIC can't do on its own. It involves a number of other state and other agencies that we need to coordinate with. We have last year we launched that work, and we are very engaged in that. So it's going to take us a little bit of time, but we are working hard on that.
Thank you. And we have many members asking what materials can they expect to help them through annual enrollment, and after annual enrollment, will they receive new ID cards, and for which vendors?
Yeah, that's so. This is a question I'll kick to Jim Rust, who's our CFO and Chief Procurement Officer. It's his members of his team that are working most closely with our vendors, but we will have robust communication to members, particularly those who are transitioning. Jim, is there anything you or members of your team want to chime in with?
Thanks, Matt. I'm sorry. Could you repeat the question? I was answering a question in the chat and I didn't catch the very beginning of it.
Emily, can you reread that? Yes, the question was about what members could expect if they'll be receiving new benefit cards. Will they be receiving them for health insurance, and as well as FSA, PBM, and what they should expect after annual enrollment?
I think the short answer is yes, they will receive new benefit cards from any of their new health plans. They will also, if they are currently an active employee from PBM, they'll receive a new benefit card from CVS, replacing ESI. And on the FSA benefit, the same thing there. Well, they'll receive new information and new cards from Task, replacing benefit strategies. I don't know if other members of my team, Cameron and Janine, want to weigh in more specifically on the health plans / PBMs, but in general, yes, they will receive communication and cards from all the new vendors.
Yeah, these will include welcome packets, all the information that you'll need if your plan is changing. We always rely on our carriers to do this sort of thing. Managing these transitions of plans is something that we understand we need to be, and our health plans need to be in close touch with our members so that you're informed and have all the materials you need.
Thank you, Matt. And on the subject of information for members are asking when they will have an opportunity to engage again with the GIC and receive more information.
Yeah, if you can bring up that slide about our member enrollments, annual enrollment sessions. This is a new feature for us this year, given the number of changes that we are putting in place. We did want to make sure that we got back out in front of our members to walk through in more detail the changes that we're making. As I said earlier, the plan design changes that I've gone through here today need to be reviewed and approved by our commission in February, so that's not finalized. We can't finalize plan specific rates until we have those plan design changes, so that will happen in the first week in March. So we did want to come back before our members with another opportunity to inform you and to get feedback in the weeks leading up to annual enrollment. As I mentioned, we've got 2 dedicated for retirees, so we'll be able to dig into some issues that are specific to that population, and then a separate set for those in our for active employees. So really encourage people to register for those and log in for those. You'll see information shortly on our website about how to do that.
Thank you, Matt. We have another question about FSA and if they are on the calendar year or the fiscal year for the benefits or benefit year, and if there will be, if we can clarify again, if there will be a grace run out period with the transfer to the new vendor.
So Cameron McBean, our
Sure.
manager of health and ancillary benefits, manages the FSA and can answer that.
Sure. The FSAs will have the same 2.5-month grace period and then 1 month additional filing deadline. So anyone with a remaining balance from the current year will have until September 15th of 2023 to receive services that can be reimbursed through their FSA. Then you'll have an additional month until October 15th to file claims with the date of service up to September 15th. Because we are changing plan administrators for fiscal year 24, Task, the new vendor, will be administering the run out claims period for fiscal 23. So you will be submitting those claims to the new carrier once July 1st has come and gone.
And I do thank you, Cameron. I do want to generally encourage members who are not enrolled in our FSA plans to evaluate them. If you're someone like myself who needs to plan ahead for co-payments and deductibles and prescription drug co-payments, it's a really good way to set aside money that's deducted right from your paycheck pre-tax, so you get a tax benefit. And you also, when you enroll in the FSA, you choose the amount that you want to save over the course of the year, whether it's $500, $1,000, $2,500. And it becomes the entire balance. So it's deducted from your paycheck weekly, but the entire amount that you choose to put aside becomes available to you on July 1st. So it's a good way to plan for how you will handle your member cost share. We do this for both health services, and there are a list of federally designated services and items that you can spend it on, including copays, deductibles, but also commonly used items that you get from the pharmacy. And we also offer a dependent care FSA for those with childcare or other related expenses. It's a good way to manage these. So I just want to strongly encourage people to evaluate that.
Thank you, Matt and Cameron. Back to pharmacy, we have the question, how are specialty medications going to be impacted by the change in PBM?
Can you repeat that question, Emily? Sorry.
Yes, how will specialty medications be impacted by the change in PBM?
So moving from Express Scripts, so this is specific to our active employee plans. We're moving from Express Scripts to CVS Caremark. That will entail a change to the specialty company. Today it's Accredo, so there will be a different company administering that on your behalf. But again, as with all of the details related to this transition, we'll be working our hardest to make sure that this transition is as smooth as possible. Janine, is there anything? Janine Dewar is our manager of pharmacy and ancillary benefits. If there's anything you want to add to what I said.
Matt, I think Janine may have had an issue with the internet, but you've definitely covered it all. That is how it will work. Sure, I can confirm that.
Thank you, Matt and Jim. And Cameron, if I can ask you again, we have a few questions asking about the FSA, and if you could clarify the periods, again, the runout periods that you previously spoke about, and if the funds will be transferring, and if members will be receiving a new card.
Sure. For member, I've been seeing a lot of questions as well, so I'm going to try and summarize a number of them. Just as a quick reminder, you must enroll in the FSA each year. It is not an automatically continued benefit. Because you are setting aside money out of your payroll, the IRS requires that members enroll actively each year and make a affirmative selection as to how much money they want to set aside. So for fiscal year 24, if you wish to participate, you will need to sign up via Task's website. For members who are current participants in the fiscal 23 plan year, currently administered through benefit strategies, your cards will remain valid and working through June 30th. Then we will have a brief blackout period to allow for a clean transfer of information from benefit strategies as the previous provider to Task as the current provider. That blackout period will only be applicable for fiscal year 23 participants who still carry a balance. During that time, you won't be able to submit claims, but as soon as the blackout period is over, you will then submit those claims to Task. So anyone who is enrolled in fiscal year 24 will receive a new debit card from Task. If you are carrying a leftover balance, your debit card from benefit strategies will no longer work after June 30th. So you will need to submit claims directly to Task via either their mobile app or their website. And then with regards to the grace periods, anyone with a remaining balance from the current year after July 1st can utilize that balance with the date of service up to and including September 15th of this year. And then you will have an additional month through October 15th to manually submit claims for against any balance that you may have that has a date of service from July 1st of 2022 through September 15th of 2023. I believe that touches on most of the questions we've been getting about FSAs. Oh, we have had some questions about the fiscal year versus calendar year. For administrative simplicity, because we have to work on a calendar year basis for all, or on a fiscal year basis for all our contracts, that is why we have the FSA set to run on a fiscal year.
Thanks, Cameron. And I think the only remaining question I saw come up is, are FSA and HSA available to retirees?
They are not, because these are funded strictly by payroll deduction. That's how they are set up with the Internal Revenue Service, which governs and oversees the regulations around these plans. That is not something subject to the GIC's discretion. We've had another couple of questions. I just wanted to let everyone know and affirm that the IRS has increased the medical FSA, what we call the HCSA, in our parlance and in some of the materials you'll see regarding the FSA plans. So the medical FSA annual contribution limit will increase for fiscal year 24 to $3,050 from the current $2,850.
Great. Thank you so much, Cameron, for clarifying all those questions on FSA.
My pleasure.
And now we have received a question. Does the always changing their name to MGH mean that I will only be able to go to Mass General facilities?
Yeah, that's an excellent question and one that's been on our minds. The answer is no. So always now Mass General Brigham Health Plan is a health plan that's owned by Mass General Brigham, the healthcare system, but it is a separate and distinct unit there and offers coverage through a very broad network, not just Mass General or Brigham and Women's facilities.
Great, thank you, Matt. And I do see a lot of questions asking how members will be able to view the materials from today's session after the session, both for members. Maybe you have coworkers who were not able to attend today, or if you were having connectivity issues or just want to look back. And the recordings will all be available on our GIC YouTube page, so you can view both this session and the two previous sessions. And we also will make the deck available. It's already available on our mass.gov/GIC website. And we will be compiling a frequently asked questions document from these as well, which we will be posting and sharing. And I see our GIC staff who are answering in the question function are answering very quickly. So I appreciate your patience.
While you review that, Emily, for questions to pull out, forgive me for being a broken record here, but as you can tell from the presentation, there are a number of changes here, some of which we've made, some of which our plans as private companies have made some adjustments to copays. I strongly urge our members to engage this year to use all the tools that we're providing to you to evaluate your options and just make sure that the coverage that you choose really meets your needs, whether it's the provider directories, whether it's, you know, a plan with a premium that you can afford. We do our very best to make sure that we provide a wide array of options that really offer you different kinds of choices. More expensive plans that have greater coverage, less expensive plans, if that's important to you, where you can make some trade-offs of, you know, not having access to every single hospital and doctor in the state. It's this is the year. We don't make changes of this type very frequently, but this is the year where we've really had to make a number of significant changes. So please, please use your benefit decision guides when you get them before annual enrollment. Use our website and all the information that's there. Consult the different carriers to understand their offerings. Use the member portal. Really strongly encourage that if you have, you know, comfort using a tool of that sort. So just really want to make sure that folks understand that this is the year really to engage.
Thank you, Matt. And I do see in the Q&A function some questions that are more personal in nature, perhaps more specific to your personal situation. And we do encourage you to use the form to contact the GIC directly. That way, a staff member can assist you and really answer the question specific to your needs and have a conversation with you there. I have a question for Paul. Probably asking if you could talk a little bit about what a qualifying event is.
Sure, no problem. Just to clarify, GIC has several qualifying events. What that means is, as state employees or municipal employees, we operate under a Section 125 federal pre-tax health plan. What this does is it allows the employees to receive a pre-tax health insurance deduction from their paycheck. As a result of this benefit, the GIC has to establish what we call qualifying events. These qualifying events focus around loss of coverage, birth, marriage, divorce, or death. This will allow members to make changes in these qualifying event categories to their GIC coverage. So it's important that after annual enrollment, if members experience any of these qualifying events, and the qualifying events can be found on our website. There are deadlines, mostly around 60 days from when you experience the qualifying event, to enroll or make changes to your GIC coverage.
Thank you, Paul. We have a similar question. We have another question on if we could talk about what defines a specialist.
I believe those are designations that are made by the State Department of Public Health, but generally, you know, your primary care. So you have a primary care provider, and then you have specialists for the purposes of insurance. We treat them a little bit differently, but you know, your primary care is there to provide, of course, your primary care provider to provide primary care, annual checkups, common and routine services for your health. A specialist, of course, whether it be a ear, nose, and throat specialist or a neurology specialist, of course, they're more focused on a particular set of conditions and a particular part of your health needs. So, you know, your primary care provider really is intended to be the overall manager of your care, whether it be specialist care, hospital care, of course, not emergency care because you just go to the emergency room, or urgent care for something like that. But they're intended to be really the quarterback of your care. They do play the role of referrals, providing referrals to specialists or other necessary care that fall beyond their scope. But generally, that's how I would describe the difference between a primary care provider and a specialist.
Thank you, Matt. Apologies, I'm giving the GIC staff time here to catch up in the chat. I see they're hard at work answering questions individually. We did have some questions, and I can go back to this slide. If you could clarify what CIC coverage is again, Matt.
So I'll probably turn it over to Cameron McBean or Andrew Stern, our general counsel, to speak a little bit more about this. But when we've had Unicare Basic as an indemnity plan in the past, there have been some services, again, this goes back many decades, that were not included in indemnity care in the same way that sort of modern health plans are. So certain services, including some expensive and complex services, have been subject to co-insurance under our indemnity plan. So in order to accommodate that and protect our members, we instituted this, what was then called catastrophic insurance coverage, to provide that extra protection. We were, there was statutory language in state law that necessitated it being a member pay all portion of your insurance. But now is the time to make that change. So this, again, I think is a real member positive addition to our coverage. Andrew or Cameron, is there anything you wanted to add to that?
I think that was a fair summary. This is a benefit to our members that the state will now be paying whatever percent it covers of premium for what used to be paid wholly by the employee out of pocket. And the plan, by incorporating this coverage, is richer than it was before.
Thanks, Andrew.
Thank you, Matt. Thank you, Andrew. And again, as we are nearing the end of our session time here, I'm giving the staff answering questions some time. We do have a question about if there are any examples you can give around CIC coverage, the type of coverage.
Yeah, I don't know if Cameron McBean has any of those handy. Cameron, if you do.
I'm sorry, I was typing. What was the question?
The question is about examples about what CIC would cover.
Sure. It was intended to cover scenarios such as someone who may need a transplant or cancer treatment, or suffers has to have significant cardiac procedure like a triple bypass, something like that. That's what that coverage was originally intended to cover. And it was again, this was, back in the days, this when this legislation was enacted, you could have medical plans could have annual coverage limits, like they would not spend more than $1 million a year, for example, on a member, if that was the plan design at the time. So this was a way of guaranteeing that the legislature came up with, that such coverage was available to GIC members, but they also implemented at that point in time that members had to pay 100% of that coverage guarantee. Now, that coverage is now included within all GIC's medical plans, which is why we decided to finally take this opportunity to get rid of that extra premium component that CIC accounted for.
Thank you for clearing that up, Cameron. And we have a question about pharmacy again. If I have an automatic prescription under ESI, the current PBM vendor, will that transfer automatically to CVS, or will I need to take action?
That is the intention. And, you know, what we're looking for is a seamless transition between Express Scripts and CVS. So if you're currently getting mail order meds, now where you get those medications may change, because it won't be through the Express Scripts, but you will receive information about that prior to the changeover.
Yes, those prescriptions will carry over, as Cameron noted. There, because we have a new pharmacy benefit manager. If you're an active, you're enrolled in an active plan, there may be some changes to the way the PBM manages that benefit. So there may be changes down the road after the grace period that Cameron pointed out. And again, that's an issue, that's an area where we will, do our best to make sure that there's kind of continuity and a seamless experience for our members.
Thank you. And I can go back to the slide here again, but we have a few questions clarifying what New England coverage, what includes, which states are included there.
So Massachusetts, Maine, New Hampshire, Vermont, Connecticut, Rhode Island. Everything north and east of New York State.
Thank you, Matt. And again, just giving our staff time to answer the questions in the chat.
Probably have time for one, maybe two more questions if we have them.
Yeah, and I can navigate back to the slide here again. We have the question asking if we could just clarify outpatient copays again for the Unicare Total Choice Plan or for the Unicare plans.
Yeah, and I would encourage folks to review the slide deck that we've used here today. It will be posted very soon on our website. Slides like this and the one about how the current plans differ from the new plans and where the default enrollments will happen if you don't choose. So those are the sorts of slides that I would really encourage our members to look at directly from the slide deck. I think that would be helpful. Well, while you're looking for any other additional questions we can address, I do want to acknowledge the fact that we had 2 members of our Oversight Commission, the Group Insurance Commission, join us today. Our chair, Valerie Sullivan, our longtime chair, and a longtime municipal representative, Melissa Murphy Rodriguez, who's the town administrator for the town of North Andover. So just want to thank them for joining us today as well. We've had, in our prior sessions, we had 4 each of our commissioners participate.
Thank you, Matt. And just to reiterate again, we will make materials available a frequently asked question document, as well as the deck and the recordings of these presentations. They will all be, you can find the way to navigate to them all through the mass.gov/GIC website. You can also search on YouTube if you're looking specifically for the sessions, but you will find those links on the mass.gov site as well. And I will navigate forward now to the annual enrollment sessions so that we have those dates again. We will be sending out the links in the same manner that we did for these sessions. We encourage you to register for the portal so you can receive this information quickly, but we will also be sending them out to the GIC coordinators of your agencies, posting them on the website and making them available so that members can register for these sessions as well. And as Matt mentioned during his presentation, these sessions will take place after the commission has made all of their final votes. So we will be able to get into more specifics on the plans there and answer even more questions.
Excellent. With that, I'd like to wrap this up. We are at time at 10:30. I want to thank each of you for your attendance here today, for the level of engagement that you continue to demonstrate. We want to do everything that we can to be transparent with you and inform you as much as we can about the decisions that we're making. As I noted earlier, and Emily just noted, all of this stuff you can find on the GIC website. Strongly encourage you to go there. And this year, please shop. Evaluate your options, get engaged, make informed decisions. With that, I thank you again and wish you the best wishes for a healthy and happy new year. Thank you so much.